This year I have the privilege to introduce our president, Elijah Dixon. Elijah was born and grew up in Winnipeg, Manitoba, Canada, where the winter was invented. Jamie and Don, his parents, had 3 boys, the Dixon brothers, and Elijah was the eldest of them. Here we see them with Don on a small acreage outside Winnipeg. They had a lot of adventures in the nearby rural areas, many of which Don and Jamie didn't find about until many years later. We see Elijah with Jamie, his mother, his 2 brothers, Nigel and Jeremy. As we can see again, more winter over there. Elijah likes cars since he was 2. But his taste has evolved since then, as you see with his last BMW model. He also liked pets when he was very young. We see Elijah with his brothers and his first dog. Hopefully, the dog survived after this photo. Here we have another of his pets, and with his favorite dog, Micah. They used to have other pets. Hopefully, they didn't bring home one they knew in Florida. As you see in this picture from a wonderful trip they had over there. Elijah became a fairly serious student early in his life. He decided he wanted to study medicine in middle school. Though his parents didn't buy toy guns, he fully embraced them whenever he had the opportunity presented itself. The lake was one of the most places he liked in the world. Here we see him with Jamie, Dom, brothers, and friends. While he grew up, he didn't want to be disturbed, less when he was reading. He used to play hockey and try other not so common sports. Look at his style in the middle and high school graduation dates. Elijah did his BSc and medical school at the University of Manitoba, but not everything was studied during that days. He moved to Calgary to do his general surgical residency. A good story as a chief of resident was when Elijah was scrubbed on a thyroid. The senior surgeon scrubbed out while he closed with the junior resident and went to see the next patient. Suddenly, they got a call from the CT scanner. They just biopsied a large liver lesion. The patient became hypotensive with significant pain. CT demonstrated significant active bleeding from the tumor. The senior surgeon had sent the patient to a trauma bay and I paged Elijah to meet her there. The patient was clearly bleeding from the biopsy. And in the trauma bay, everybody continued to have him paged while the senior surgeon was starting a central line, bobbed her next case, and brought the patient to the OR. Still, no sign of Dr. Dixon. The patient, an achondroplasia dwarf that had a tracheostomy scar because of a difficult intubation years ago, needed an airway secured. Anesthesia was unable to intubate, so the senior surgeon started to do a tracheostomy. Still, no sign of Dr. Dixon. Paged him again for the 4th time, and his beeper went off in the OR as he and the junior resident left their pages in the OR while they went for lunch. Airway secure, Elijah finally wanders into OR that the senior surgeon was about to do the laparotomy. The lesion turned out to be a 14-centimeter hemangioma, blood pouring out from the biopsy site. Patient unstable and clearly suture would cause more bleeding, and a standard right trisect was needed, so Elijah suggests to insect the biopsy hole with Tysol. Plug it up, he said. So they do it. They did it. Bleeding stops, patient survives. The next day, while they were feeling proud of themselves that they saved the patient, Elijah pulls up 3 articles cautioning the injection of Tysol into tumors as it causes embolization, resulting in stroke, pulmonary embolism, and death. He wrote this paper, and sure it was the start of his HPB experience. He still laughs today with the senior surgeon about how he went for lunch while she was left by herself in the trauma bay, resuscitating a patient, doing an emergency tracheostomy, and he centers in and injects 10 cc of Tysol to save the day. During that time in Calgary, he used to go trekking here with his dad, and also do rafting. In 2001, Elijah moved to Toronto, where he did his fellowship in hepatobiliary, pancreatic surgery, and gastrointestinal transplantation. Here we see him in a picture of Toronto Fellows 1983-2004 with Professor Langer. According to Elijah, Toronto gave him not only the technical training and skills, but also showed him the true importance of why to become an academic surgeon. He knew some colleagues that became very close friends of his, like Paul Gregg, Chuck Vollmer, and Mark Cottrell. In 2002, Elijah went to Harvard School of Public Health and did a master's in epidemiology. In 2004, he returned to Calgary, where he became associate professor of surgery, oncology, and community health science. We see him with Janice Pisica and Chad Ball, his colleagues and friends in Calgary. A nice story from the last years is when a nameless resident took Elijah to see one of his patients to consent her for Whipple. Elijah spent a long time with this patient who he did not remember. He went through all the details of the operation in front of the team and went over to the risks and benefits of the operation. Finally, at the end, he pulls out the consent and asks her to sign for a Whipple. So the woman lets out an anguished cry and says, you mean I need another Whipple? They are not sure where that resident is at this time. In 2008 and 2009, he was awarded the Traveling Fellowship of the SSAT that allowed Elijah to visit two leading cancer centers in the world, Memorial Sloan Kettering and MD Anderson. His goals were the enrichment in three areas: scientific and research, clinical and operative care, and career development. According to his report, he surpassed all of these goals. Most of all, he remembered the great hospitality of Bill Jarnagin and Nick Voté during his stay in both places. He became member of the council in 2008 during the presidency of Mark Callery. He also became Canadian Surgical Association of General Surgeons president in 2014, together with his HPB presidency. This clearly demonstrates Dr. Dixon's capacity as an HPB leader, also demonstrated by 160 peer-reviewed papers, 24 funded protocols, 48 research projects supervised, and being a member of 6 journals' editorial boards. According to a medical student, Elijah Dixon is a rock star among surgeons. He is a wise surgeon, recognized by peers, that has made many contributions to the field, likes the teamwork, and likes a lot what he do. An example of his sense of responsibility are these pictures that he sent of his car, his house, and the row a day in Calgary when he couldn't make it for a call last year. But Elijah has some other particular qualities. Friendship means a lot to Elijah. He still has friends from school. There is a story when Stephanos Debrew and Elijah were senior residents. Stephanos had a serious problem with migraines. Elijah sent him home and he did all the calls for a week, as they were the only seniors in the hospital. This is an indicator how Elijah supports his friends. Elijah is a vegetarian since he was born. A medical student was overhead discussing Dr. Dixon and was astonished that he was a vegetarian. His comment was, wow, he must eat a lot of vegetables. He came to Argentina twice. You know Argentina is the meat country. This year. And he became interested in cows, but only scientifically. He learned some meat cuts. Hopefully we had the opportunity to show him other great things of our country, soccer. As everybody knows, Elijah's president and president-elect travel a lot to different chapter meetings. We discovered one more quality of Elijah in the last year. His capacity of sleeping in any kind of transportation probably acquired during the Toronto days, as you see in this trip to Tarija, Bolivia. Our observational study demonstrated that he doesn't change the position in the car during the outward journey and the return journey. And as you see, the same happens at home. Elijah is a UFC fan. He knows a lot about this mixed martial arts championship. I'm sure he has dreamed being a fighter of one of these tournaments. This is probably because a taste he acquired when he apparently became quite a boxer in his youth, as you see in this picture. As you see, some of these UFC fights seem an OR of liver transplant in the old days. After a hard day, Elijah wants to relax, going for a bike, like in this case, riding the Golden Gate after ACS in San Francisco. He usually says about that day that his friends tried to kill him. Or racing cars, problem here was finding the correct helmet size. Elijah still loves the lake and goes over there to spend weekends or holidays whenever he has the opportunity. But most important of all in Elijah's life are his two daughters, Natalie and Gabrielle. Here we see them when they were very young. During their childhood, Elijah involved them in the activities he liked. Here, going for a walk with Natalie when she was very young. But it seems Natalie didn't like it too much that day. Natalie and Gabrielle likes to play soccer, baseball, or catch with Elijah. They say that her dad likes to watch football and sleep at home, but also to get dressed in his snow gear and ride around on their drive while blowing snow everywhere on his John Deere snow blower. Here in their last trip to New York in a shopping day. His dad does not like when they are watching TV in his room when he gets home because he wants to have a nap. We listened that before. He gets very grumpy and he starts to stand in front of the TV and make strange poses that finally gets them to move. Elijah is a great father that loves to be at home with his daughters, and you see, he still likes dogs. With that, ladies and gentlemen, I give you our HPB president, Elijah Dixon.